Assalamualaikum warahmatullahi wabarakatuh and good afternoon to Dr. Gan and friends. We are Group 2 L01 B03 will be presenting our task problem based learning number 2 which is magnetic resonance imaging MRI. Before I'm starting with our presentations in details, I will introduce my team members first. My name is Ainiena Syafienasz and I accompany with Muhammad Haziq, Afifah Amirah, Ammar Husaini, Hairi Ezzanie and the last presenter is Syahmi Malik. So I'm the leader for today and will conduct with our PBL sessions meeting. Before we start, I would like to describe what is involved in the task in these PBL sessions. Basically, a nurse who just graduated from nursing school was pushing an all-male patient with ischemic cardiomyopathy to the MRI room. Although the nurse forgot to ask the patient whether he has any metallic implant, she has checked the patient with both initial and portal ferrous detector. After the patient was brought into the MRI room, he was attracted the modality and nearly cursed his life. An investigation was conducted as a MRI specialist for that modality. We are required to find out the causes and any procedural misstep based on the several tasks, which is the operational mechanism of MRI by using a magnetic field. Number 2 is the safety standard of procedure SOP when using MRI. The third point is if the nurse has violated the SOP, the reason why the patient was pulled toward the modality, and the last is the final conclusions after the investigation. The next will be introductions will be done by the task. So what is the magnetic resonance imaging MRI? An MRI or magnetic resonance imaging scan is a non-invasive and is a radiology technique that uses magnetism, radio wave, and a computer to produce image of a body structure. The MRI scanner is a tube surrounded by a giant circular magnet. The patient is placed on a movable bed that is inserted into a magnet. The magnet creates a strong magnetic field that aligns the protons of hydrogen atom, which are then exposed to a beam of a radio wave. This spins the various protons of the body and they produce a phase signal detected by the receiver portion of the MRI scanner. A computer processes the receiver information and an image is produced. The image and resolutions produced by MRI are pretty detailed and can detect a tiny change in structure within the body. For some procedures, the contrast agents such as gadolinium are used to increase the image accuracy. Next, we go to the first point, which is the operational mechanism of MRI using a magnetic field. The MRI is the commonly used to examine the body, the bones, joints, and soft tissue such as muscle, cartilage, and tendons for things like injuries such as fracture or tears to a tendon, ligament, or cartilage. Next is the main component at the MRI, which is number 1 is static magnetic field coils. Number 2, gradient magnetic field coils. Number 3, magnetic shield coils. Number 4, radio frequency coils. Number 5, subsystem control computer. Number 6, data transfer and storage computer. And the last one is the physiological monitoring, stimulus display, and behavior recording hardware. Okay, the more detailed explanations about the operational mechanism of MRI using magnetic field will be continued by Muhammad Haziq. Thank you.
All right. Thank you, Ainiena. Okay, I will continue with how the MRI works. Okay, the MRI employ powerful magnets which produce a strong magnetic field that force the protons in the body to align with that field. When a radio frequency current is then passed through the patient, the protons are stimulated and spin out of equilibrium, straining against the pull of the magnetic field. When the radio frequency field is turned off, the MRI sensors are able to detect the energy release as the proton realign with the magnetic field. The time it takes for the protons to realign with the magnetic field as well as the amount of energy release change depends on the environment and the chemical nature of the molecules. Physicians are able to tell the difference between various types of tissues based on these magnetic properties. Okay. Next, the image process. To obtain an MRI image, The patient is placed inside a large magnet and must remain very still during the imaging process in order not to blur the image. Contrast agent, often containing the element of gadolinium, may be given to a patient intravenously before or during the MRI to increase the speed at which protons realign with the magnetic field. The faster the protons realign, the brighter the image. In illustration A, at the left side, we can see it is the origin of hydrogen nuclide with a strong magnetic field in the absence of a strong hydrogen line as shown in bracket A. Meanwhile, in bracket B, when the strong magnetic field is applied, the hydrogen nuclei realign about the direction of the strong magnetic field. In illustration B, in the bracket A, the RF pulse, which is BRF, will cause the net magnetic moment of the nuclei to tilt away from magnetic field. When the RF pulse stops, the nuclei will return to the equilibrium such that the net magnetic moment of nuclei is again realigned to the magnetic field. During the realignment, the nuclei will lose energy and a measurable RF signal. This is how the image can be extracted during the MRI modality. The spin realization, it is when the electromagnetic field is turned off, the nuclei will return to their original position around the external magnetic field. This interaction with molecular field can be characterized by T1, which is recovery, and T2, dephasing. T1 is a process that can thought as forcing DM, which is a net magnetic moment, back into the Z direction, which is a magnetic field. And T2 is a process which breaks the M into the constituent parts. Okay, that's all from me. I will return back the presentation to Ainiena. Thank you.
Okay, thank you Haziq for the wonderful explanation. So I will be continue the explanations about T1 realizations. Okay, T1 is the forcing M back into the Z directions or the restorations of magnetic moments towards their original directions. After excitations, the nucleus spins passing in the presence of a small fluctuating magnetic field set up by electronic motions in the surrounding molecules, depending on the temperature and the nature of the tissue. Thus, a fluctuating environmental field gives rise to a spectrum of photons. Those with just the right energy can induce transitions between the nucleus spin state and restore equilibrium. Classically, this is equivalent to a frictional force tending to a realigned M with the Z-axis. This is what we call longitudinal spin realizations. The next part is the T2 realizations. Breaks M into its constituent part or the loss of phase in the nuclear positions after an electromagnetic field is removed. Each nuclear spin is precising in a slightly different static field and each has a slightly different Lamar frequency and adequate transfer realization time in the T2 together describe the dephasing process. It takes place without altering either the energy or the entropy of the rotating nucleus phase, and in consequence, the ideal process is reversible. So that is all my explanations in the part 1. The next part will be passed to Afifah Amirah. Please welcome.
Okay, thank you Ainiena. My name is Afifah Amirah and I will continue the discussion about the SOP when using the MRI. As you all can see in the slide, there are 16 listed SOP for MRI, including the SOP for access control, SOP for equipment and material facility safety breach reporting, gadolinium use research subject. Next is SOP for implant and device, infection and allergy control, including the SOP for MRI safety committee. MRI safety training, pregnancy and MRI safety, reporting requirements, safety MRI scanning, general scanner usage, study personal responsibility, SOP for safe scanning with animal subjects, scanning at 7 Tesla, and the last is the SOP review of research MRI application. Okay, basically the procedure during MRI is firstly the patient will typically receive a gown to wear during the MRI examination. Before entering the MR system room, the patient will be asked a variety of questions using a special screening form. This is the form in the slide, and the patient also will be asked about if he or she include the have implant or device. Next, patient will be instructed to remove all metallic objects from pocket and hair as well as metallic jewelry. The MRI examination is performed in a special room that houses the MR system or scanner. Patient will be escorted into the room by a staff member of the MRI facility and asked to lie down on a comfortably padded table that gently glide you into and out of the scanner. The typical scanner is open on each end or at least two sides. Okay, in general, in preparation for the MRI examination, you will be required to wear earplug or headphone to protect your hearing because many scanning procedures produce loud noises. For some MRI exam, a contrast agent called gadolinium may be injected into a vein to help obtain a clearer picture of the area being examined. Typically, at the beginning of the imaging procedure, a nurse or MRI technologist will place an intravenous line in your arm or hand vein using a small needle. This will allow injection of the gadolinium contrast agent. The line will be connected to a saline solution that will drip through the intravenous line to prevent clotting until the actual contrast agent is injected at some point during the exam. Sometimes the contrast agent is injected with an automatic device and sometimes it is necessary for the technologist or nurse to come into the room to inject the contrast agent. They may even have to slide the table out of the scanner to do this. The most important thing for the patient to do is to lie still and relax. Most MRI exams takes between 15 to 45 minutes to complete depending on the body part image and how many images are needed. Although some exams may take about 1 hour or longer. You will be told ahead of time how long your scan is expected to take. You will be asked to remain perfectly still during the time the imaging takes place, but between sequences, some minor movement may be allowed. The MRI technologist will advise you accordingly. When the MRI exam begins, you may breathe normally. However, for certain examinations, it may be necessary for you to hold your breath for a short period of time. During your MRI examination, the MR system operator will be able to speak to you, hear you, and observe you at all times. When the MRI exam is over, you may be asked to wait until the images are examined to determine if more images are needed. After the exam, you have no restriction and can go about your normal activities. Once the entire MRI examination is complete, the image will be reviewed by a radiologist, a physician who has been specially trained in interpret the scan for your doctor. I think that's all from me. Thank you. I will pass back to Ainiena.
Alright, thank you so much Afifah Amirah for the great information regarding the safety standard of procedure SOP when using the MRI. The third task will be presented by Ammar Husaini. Please welcome.
Thank you to Ainiena. For my part, I will explain about if the nurse has violated the SOP. Based on the question, despite checking the patient with both initial and portal ferrous detector, she violated the SOP because she did not ask the patient if he or she had any metallic implant. Accident involving in this situation can occur for a variety of reasons, but there are four more common causes. The first one is safety protocol which aren't up to standard. Some MRI center have a dangerous gap in their safety procedure due to insufficient or obsolete safety protocol, allowing untrained staff or maintenance personnel into the MR system space, insufficient training program, a lack of policy on the use of certain type of equipment in the MRI area, and failing to verify equipment labeling are all common example. The alternative way is to appoint an MRI safety officer who will be in charge of designing and enforcing proper safety policies and procedure. The next is staff member neglect for safety precaution. This happened because MRI facility staff members have not been adequately briefed and instructed to follow the facility safety procedure and therefore are unaware of them. Cleaning and repair personnel as well as non-MRI emergency personnel are often involved in accidents where this is the cause. A concerted effort to educate and prepare all those interested in the MRI field is needed to voice this issue. Next is unintentional disregard for safety procedure. Due to lapse in focus or make poor decision under extreme stress or in emergency scenario, employee can accidentally ignore safety protocol. This will and sometimes does happen with like highly experienced worker. Long experience and a clear track record cannot guarantee protection in this situation. While routine experience in emergency situation can benefit, there is no practical mitigation against this. The last one is disregard for safety precaution on purpose. Because of their experience working in this sector, certain employee lack safety policy. Any employee with such attitude may believe that certain part of their safety policy are unnecessary or inaccurate and have chosen to disregard them. Fundamentally, this is about the employee attitude. Character traits such as arrogance, modesty, or desire to take risk can contribute to this. It is difficult to prevent this problem, but training and safety check will help. Staff employee who fail to follow protective procedure should face disciplinary action. This is a safety guideline emergency plan in case accident involving MRI screening. The first one is develop and review evacuation procedure for emergency personnel. There must be emergency phone number open and map of the following location. Emergency button and emergency exit. Next is in the situation of an emergency or accident, remove patient and personnel from MRI room. Notify staff involved and do not press quench button if no one is stuck inside the magnet. Next is emergency rundown unit or quench button can only be pressed if life-threatening to patient or staff. For example, patient stuck by magnetic object inside magnet and cannot be removed. The second is safety personnel such as firemen need to put out a fire in the MRI room. Do not press quench button if an object is stuck but not life-threatening. Inform the hospital authority for next course of action. And the last one is other emergency button that can be activated anytime if required. The first is electrical stop button. The function of electrical stop button is to shut down the MRI in an emergency situation. The second is patient table stop button. The function of patient table stop button is to remove patient from magnet by pulling the table manually. I think that's all for me for now. I will pass back to Ainiena.
Okay, thank you, Ammar, for the more wonderful detailed explanations. Now, the next person will be presented by Hairi Ezzanie. Please welcome Hairi.
Okay, thank you, Ainiena. Okay, I will continue explain about my part, which is the reason why the patient was pulled toward the modality. Okay, the reason why the patient was pulled toward the modality, it is because the patient had a ischemic cardiomyopathy. Okay, what is the ischemic cardiomyopathy? Ischemic cardiomyopathy is the most common type of dilated cardiomyopathy. In ischemic cardiomyopathy, the heart's ability to pump blood is decreased because the heart's main pumping chamber, the left ventricle, is enlarged, dilated, and weak. This is cause ischemia, which is a lack of blood supply to the heart muscles, caused by coronary artery disease and heart attacks. Okay, what is the ischemic cardiomyopathy symptoms? There are several symptoms such as shortness of breath, swelling of the legs and feet, fatigue, which is feeling overly tired. Angina, which is the chest pain or pressure that occurs with exercise or physical activity. Weight gain, cough and congestion related to the fluid retention. And lastly, dizziness or lightheadedness. Okay, next is for the diagnostic test. Diagnosis of CM is based on your medical history, which is symptom of family medical history, physical exam, and other tests. Specific tests may include blood tests, ECG, chest X-ray, echocardiogram, exercise stress test, cardiac catheterization, CT scan, MRI, and last but not least, radionuclic radionuclic studies. Occasionally, a myocardial biopsy may be done to determine the cause of the cardiomyopathy. During a myocardial biopsy, small samples of tissue are taken from the heart and examined under a microscope to determine the cause of the cardiomyopathy. Okay, last but not least is about their treatment. Okay, for the first is the medication and the second one is the lifestyle changes. Okay, for the medication are used for two reasons, which is to improve the cardiac function and to treat symptoms and prevent complication. Okay, the medication is to control heart failure. Most people get better by taking a beta blocker and an ACE inhibitor. Even they have don't even if they don't have symptoms. If symptoms appear or worsen, other drugs are added as needed. Your doctor will discuss which medication are best for you. Okay, for the second, for the treatment is lifestyle changes. It's divided into two, which is diet and the exercise. For the diet is as soon as you develop symptoms such as shortness of breath or tiredness, follow this low sodium diet. Even your symptoms seem to have subsided. Most of your ingest salt come from the processed food. In addition, to remove the salt shaker from the table while working, read all the food labels for sodium content and serving size so you can track your sodium intake. Okay, for the last one is exercise. The doctor will tell you whether or not you can exercise. Non-competitive aerobic exercise is recommended for the most people with cardiomyopathy. Weightlifting may not be recommended. Okay, that's all from me. Thank you. I will pass back to the Ainiena.
Okay, thank you, Hairi, for our good explanations regarding the reason why the patient was put toward the modality. So, the last our presenter will be passed to Syahmi Malik. Please welcome.
Thank you, Ainiena. So for this part, I will explain about the conclusion that can be made based on the case study of our PBL, which is problem-based learning. There are 6 points here, as you can see. The first one is MRI is a scanning machine that uses magnetic field as their medium. And then the second point is there is a few SOP that the staff need to be followed before, during, and after the MRI scanning. So the emergency plan and emergency button is important if the SOP is not followed strictly. So if any matter needs to be removed before patient undergo the MRI scanning. So if patient is wearing a pacemaker, it need to be set in MRI special mode. And then according to the patient condition, he or she should not undergo the MRI procedure. That's all for me. I will pass back to Ainiena.
Alright, thank you so much, Syahmi, for the wonderful explanations with good final conclusions after investigations. So I will conclude the overall presentations that our task problem-based learning number 2 MRI. In the first part, we learn and know the main components are used in MRI, the MRI principle, image process, the comparison illustrations on the behavior of protons inside the human body. We also learn and understanding the explanations about spin relaxations, T1 and T2 relaxations. The second point is the safety standard of procedure. We know the list of MRI standard or procedure, which is the access control, facility, infections, and more. Nonetheless, we also know the special screening form of our MRI, which is the MRI procedure form for the patients. The third point that is the nurse has violated the SOP. So we also know the protocol unintentionally disregard for safety procedures, safety guideline, and more. The last point we learned about PBL number 2 is the final conclusions after investigations with the increasing prevalence of implants in an aging of populations and increasing demand for MRI in the same group. There will increasingly be called human imaging center to be capable of scanning this patients group, opening up the possibility for patients with MRI conditions and implants in need of an MRI scan requires educational initiative for changing the risk perceptions that implanted cardiac devices are always a contraindication for MRI. Okay, the last hour meeting will be regarding the questionnaire. If some of you have any confusions, you can ask now.
Okay, I have one question to Haziq. Can you hear me, Haziq?
Yes, I'm here.
Okay, I have one question about your previous explanation on the slide. Based on the behavior of the protons you have described before, how can an image be derived from it? That's my question.
All right, Afifah. Thank you for the question. Okay, first, when you look back at the illustration B, once the RF signal is removed or turned off, the nuclei realign themselves such that their net magnetic moment is again will parallel with the magnetic field. This return to equilibrium is referred to as relaxation. During relaxation, the nuclei lose energy by emitting their own RF signal. This signal is referred as the free induction decay (FID) response signal. The FID response signal is measured by a conductive field coil placed around the object that being imaged. This measurement is processed or reconstructed to obtain a 3D grayscale MR image. That's my answer for you.
Okay, thank you, Haziq, for your explanation.
I have a question for the Ainiena. Ainiena, can you hear me?
Yes.
Okay, good. Okay, Ainiena, what is the MRI modality used in radiology to find the problems? And you have mentioned in the main component that magnetic shim coils used. So what is the function of the magnetic shim coils? Can you answer it?
Okay, Hairi. Thank you for your questions. Okay, as we know that the MRI modality is used in radiology to find the problems such as tumor, bleeding, injury, blood vessels disease or infections, as well as MRI also be done to provide more information about a problem seen on an X-ray, ultrasound scan or CT scan. Okay, for the answer, magnetic shim coil is the shim coils are designed to generate a specific magnetic field, which means to prevent signal draw out and fill in the gap caused by distortions in the magnetic field. It also the process of adjusting the magnetic field to make it more uniform. Then the shim are positions around the magnet. The interior side of the magnet is covered with gradient coils. So the coils help vary the magnetic field and also cover by thermal shielding to protect the patients from fluctuations in the temperature. Do you get it, Hairi?
Yes. Thank you, Ainiena.
Alright.
I got a question regarding to the SOP for Miss Afifah. So the question is, what are the potential hazards associated with MRI, and what to be avoided before an MRI procedure?
Okay, thank you, Syahmi, for the question. For the first question about the potential hazard associated, there are 5 potential hazards associated with MRI, which is the first one is hazard with static magnetic field. The second one is hazard with time varying magnetic field gradient. The next one is hazard with pulse radiofrequency field. Hazard acoustic noise exposure to MRI during pregnancy, and the last one is hazard with cryogens. And about the how to avoid what to be avoid before an MRI procedure is don't get any new piercing. Besides, don't disregard doctor's instruction. If the doctors tell you to avoid certain food or try to diet before MRI, make sure to follow and the last don't disrupt your schedule. You may continue any medication as usually work and don't stop participating in any ordinary activity. By maintaining your usual lifestyle, you will help to ensure the scan is accurate and misleading result. That's my answer. Did I answer the question, Syahmi?
Yes, thank you, Afifah, for the great explanation.
Okay, thank you.
Okay, Ammar, do you hear me?
Yes.
Okay, Ammar, I have one question for you on your part, which is if the nurse has violated the SOP, so may I know what happened when the quench button is pushed?
Thank you for the question. Based on the question is what happened when the question button is being pushed. Pushing the quench button will cause the liquid helium that cool the magnet to rapidly boil off. The quench pipe above the magnet is designed to allow the helium vent outside of the building. If the quench pipe fail, there is a danger that the magnet room will be filled with helium and that the oxygen in the room will be displaced, which could cause injury or death for anybody in the magnet room or the console room during a quench. Quenching the magnet can be dangerous due to the rapid boil of helium, which create dangerous high pressure and could displace oxygen from the room. A quench could cause permanent irreparable damage to the magnet. If the magnet survives the quench, it will have to be recharged, which is very costly and time consuming. I think, is that answering your question?
Okay, thank you, Ammar.
Okay.
Hairi, are you
Yes,
there?
yes,
Okay.
I'm here.
I have a question for you about the ischemic cardiomyopathy. Okay, what is
Okay.
the cause? What's the cause of it?
Okay, thank you for the question, Haziq. Okay, there are two causes for the ischemic cardiopathy, which is coronary artery disease and the heart attack. The major risk factors of heart disease such as family history, high blood pressure, smoking, diabetes, high blood cholesterol, and obesity can also place one at increased risk for the cardiovascular disease and ischemic cardiomyopathy. Okay, that's all my final answer. Did you get it, Aziz?
Alright, Hairi, thank you.
Alright, welcome.
I have a question for Syahmi. Based on your part that you explained before this, what are potential risks of active cardiac device in MRI?
All right, thank you for the question, Ammar Husaini. So based on my study that the pacemaker and ICDs are complex electrical active cardiac device which may interact with a magnetic field of an MRI system in a different way. There are basically three main risks. The first one is that the active cardiac device cannot differentiate in street heart activity of a patient from past electromagnetic field of the MRI system. As a consequence, the magnetic resonance scanning may block or inhibit cardiac pacing, which may be harmful or even fatal for pacemaker-dependent patient. So the second one is the heating of the device leads due to the interaction with the radio frequency field used in the MRI that can lead to thermal tissue damage in the heart muscle and irreversible pacing capture threshold increase. So the third risk is that the gradient field used in the MRI may induce voltage pulse in the leads that can induce severe cardiac arrhythmia. Is that answering your question, Sir Ammar?
Yes. Thank you very much.
All right.
Alright, so we are done with our meeting discussions and our Q&A. Thank you for the extra commitments today. So thank you so much. See you next time.